That's the mass.
Yeah. It's
Alright, whenever you're ready.
quarter thing.
Okay, so have you guys ever noticed anyone who is like super fidgety during class and just like moving around all the time, and like all you want to do is just like yell at them and say like stop? And I'm one of those people. I hate it when people move around and they're all like fidgety in class. But like, have you guys ever considered that that person may have restless leg syndrome? So restless leg syndrome, which I will be referring to as RLS for the most of the speech, is defined by, according to this study done by Tater and Panley, a neurological disorder characterized by sensory motor abnormality leading to an irresistible urge to move the limbs due to abnormal, unpleasant sensations involving the limb. And I know that's a mouthful, like that doesn't make sense, but I'll break it down in just a minute. I'll be talking about RLS in a way that relates to me because I have restless leg syndrome, but I'm lucky enough to not experience a lot of the burdens that other people may experience with restless leg syndrome. So why is RLS so important to learn about? Only about 2.5 to 15% of people have it, so it's not really that common. And most of them are older women, so you guys are like, who cares? But you may be affected by it in the future, because it's pretty common in older people. Or you may even suffer from it today. But again, what most people don't know about RLS is the burden that comes with it. From the disturbance of sleep to the impact that it has on your mental health, there are so many things that people don't know about RLS, and I think is really important to talk about so people are more knowledgeable about it. So I can't diagnose anyone with RLS in here, but I suggest if you like are listening to these symptoms and you're like, oh yeah, I relate to that, maybe see a doctor. I don't know. And before I go into how RLS affects the patients, I'm going to give a more clear definition of what it is and the symptoms that come with it. So there are hundreds of thousands of definitions for RLS, but the most simple one and the most clear one, in my opinion, it's basically this urge to move your leg, and it comes with like an uncomfortable, unpleasant sensation in your leg. Now, some of you guys may have experienced this at one point. You know, when you're sitting down for a long time, your legs are numb, and you just want to like stretch it and bend it. This is a little bit different. For people with RLS, this is like a continuous sensation, and it even gets worse during the nighttime. So I was looking at pictures of where RLS is most common, and this is where I found that it was most common for me, like kind of the calves in that area. So it could be different for people, but this is for me. So some typical symptoms of RLS include, as I mentioned before, an urge to move the legs because of an uncomfortable sensation. And this sensation, it worsens when you're lying or sitting down. Walking, stretching, and bending the legs can often temporarily relieve you of these symptoms. And most of these symptoms actually worsen at night or bedtime, which is, I'll talk about it later, but that's why it disturbs a lot of people's sleep. And in 1995, the International Restless Leg Syndrome Study Group created this definition, but one problem with RLS is that it's really hard to diagnose, and it's often underdiagnosed by doctors. So in 2003, the same group decided to publish new criteria to really ensure that the symptoms are not confused with symptoms of similar disorders. So other disorders like leg position discomfort, leg injury, arthritis, leg cramps, or nerve damage, these are things that may have similar symptoms. However, they don't come with the urge to move the leg. You do have that discomfort, but it's not the same urge to move the leg. There's a fine line that divides these things from RLS, and that's why I think, and from what most of the studies I read, I think it's really important that researchers research more about how we can diagnose RLS, because as I mentioned before, it's so underdiagnosed, and some people don't even know they have it. So there are two classifications of restless leg syndrome, depending on why the patient was diagnosed in the first place. So there's primary RLS. This is our age group would most likely have primary RLS. And based on a 2007 study by Merlino, primary RLS is typically through genetics and hereditary forms. And it's also the most common. 70 to 80% of people have it. And when they take like blood tests, lab tests, they all come out normal, so it has nothing to do with like the body itself. Adolescents can also have RLS, which most people don't know. They think it's like an older people thing, but adolescents can also have RLS, so in our age group as well. On the other hand, secondary RLS occurs in about 26% of cases. So it's not as common, and it's symptomatic of a specific disease like iron deficiency, or even pregnant women also have RLS. So there's no known cause for the disorder. They're still doing a lot of research on it. But the most common one, identified by a study by Heron in 2002, has identified like abnormalities in the central nervous system as one of the causes, and iron deficiency as another cause. I have iron deficiency myself, and I'm going to talk about the treatments for the different things, but treatments for RLS are pretty difficult to assign to a specific person because of the many different symptoms, how severe it is. Sometimes treatments like medicine doesn't even help. And many people, because of the misdiagnosing I was talking about earlier, many people end up not knowing which treatment to give the patient. So one type of treatment is pharmacological, and according to a study by Phillips in 2008, iron replacement pills, which is what I take, it helps with the iron deficiency side of RLS. And for pregnant women, folic acid can help. And there's also different medicines. I'm not going to go too deep into the actual medicine name because it's not that important. But, I mean, it is important, but it's kind of hard to remember, and it might not apply to you guys. But there are different medications, prescriptions that you can take. Another thing that might help is exercise. Again, the urge to move. Exercise can help with that. Massages can help with that. And even people have said acupuncture, avoiding caffeine and alcohol tends to help with that. Vitamins and hot baths. So I can just spend 10 minutes talking about all the different treatments and when each treatment is most useful. But the most important thing to understand, and what I'm about to talk about, is a key point in today's speech. So all this information may not sound very exciting. You're kind of like, this is so boring, this is medical information. And you may think, so what? What most people don't know is that restless leg syndrome can severely reduce your quality of life. One aspect of our lives that it does affect is sleep, and that's the most common thing that I feel like some people might know of. So there's something called periodic leg movements during sleep, and about 80% of patients who have this periodic leg movements during sleep, it wakes you up in the middle of your sleep, but you don't know that it's waking you up. So when you wake, for me, I'll sleep 10 hours, and I wake up and I felt like I slept 4. So I had to do a sleep study. It's called a polysomnography. That's a technical term for it. And it looks kind of scary, but you just get, that's really blurry, but you just get hooked up to a bunch of machines. And it's just checking your limb movements, eye movements. And the discovery for RLS patients is shocking. Only 85% of patients have difficulty falling asleep, or they wake up during their sleep. And as you can see right here, the red line is an RLS patient, and the blue line is a normal person with no sleep disorders. And as you guys can see, the RLS patient never even reaches stage 3 or stage 4 of sleep. You need to go through these stages of sleep to actually get your full night of sleep, to retain your information at night. And they also have a lot of periods of going back up and waking up again. And almost half of RLS patients experience daytime fatigue or sleepiness as a result. And as you grow older, the symptoms become worse. Now, you guys may have known that it affects your sleep, but another thing that it affects is actually your quality of life. So your cognitive functions are impaired. People with RLS have daytime drowsiness, a lot of fatigue during the day. They even might get drowsy while driving. And there's studies that have shown that people with RLS are typically late to work, they miss work, or they make errors at work. So a cross-sectional study conducted in 2011 analyzing the link between psychological distress and patients suffering from RLS discovered that anxiety disorders and depression is much higher and much worse for patients that have RLS. And patients also even show signs of compulsive disorder. So this is a side of RLS that I feel like most people don't know about. So besides the medical and technical side of RLS, what many people may not know about is how it impacts your way of life and your quality of life, and it's really reduced compared to a normal person. So I say the next time you see someone in your class being all fidgety and moving around, instead of like thinking in your head like why won't they stop and like yelling at them in your head, I suggest maybe considering if they have RLS, or maybe if you guys do. Thank you.